Hello, my name is Sulina Powell. I'm a nursing student at Indiana State University. This presentation is for Community Health 444 class, and I will be discussing hospice care. These are the learning objectives for this presentation. So by the end of it, you should be able to understand what hospice care is, be able to name at least 5 diagnoses that meet hospice criteria, be able to name at least 5 services that are provided by hospice, be able to name at least 2 misconceptions about hospice, and ways that hospice care is covered. But before we do that, why don't we just take a quick pause. So please pause the video at this time and take a few minutes to complete the attached pretest. So what is hospice care? Hospice care is end-of-life care for anyone who has been diagnosed with a terminal illness. Usually, the healthcare provider will suggest hospice care when all potential curative treatments have been exhausted and the likelihood of patient making it past 6 months is minute. The wonderful thing about hospice care is that they focus on managing the end-of-life symptoms to provide quality of life. So although hospice can't add more days to one's lives, it can provide more life to the rest of their days. Hospice works as a team to assure that patient needs are met on physical, psychosocial, and spiritual level. The patient is always at the center and is placed first, but also it assures to keep the family and caregivers within that inner circle, as they are not just part of the team caring for the patient, but they also need the support of the professional team to make it through these difficult times. There is a common misconception that hospice is only for adult patients. However, hospice can be for anyone facing a terminal illness despite their age. Some of the more frequent diagnoses are end-stage lung disease, end-stage kidney disease, end-stage liver disease, cancer, and Alzheimer's dementia. But, as I previously mentioned, it is not limited to just those. However, both the hospice physician and patient's medical doctor must agree that patient meets hospice criteria and that if the patient's disease runs its typical course, the patient does not have longer than 6 months to live. But it doesn't stop there. If patients show signs of decline and they happen to outlive the 6 months, they just need to be recertified for another 6 months as determined by the healthcare providers. But if they show signs of improvement, they can graduate from hospice until they meet criteria again. Hospice is such a great option to have as it provides so many lovely services. You get a wonderful care team that visits you in the comfort of your home, ALF, or long-term care. Usually the team will visit once a week, but will visit more if needed. The team will help manage all your medications and provide all the education that is needed. These medications are usually covered under hospice care. They will make sure you have everything you need as far as equipment goes, whether you need a walker, a bedside commode, oxygen, mechanical bed, and that list goes on. If you require physical therapy, occupational therapy, speech therapy, dietary counseling, that is also all included under hospice care. If symptoms seem to get out of hand at home and something more aggressive needs to be tried, patient can temporarily go inpatient hospice until symptoms are better controlled. Respite care, which allows a primary caregiver, usually the spouse, to take a short break from having to be so hands-on. You also get spiritual services through chaplains and grief counseling for anyone who needs it. That also includes the patient. And many hospices offer certain entertainment or hobbies such as massage, guitarist, knitting, arts and crafts, and many more. Even more amazing, hospice is available 24/7. Even in the wee hours of the night, the patient or family is able to call hospice with any questions or concerns, or if they have any extra visits that the team needs to do. There seems to be many misconceptions about hospice, but these are the 4 most common misconceptions. Patients think that in order to receive hospice care, that they need to have a do not resuscitate order in place. This is not the case. Having a DNR is a personal choice that sometimes requires a collaborative discussion and decision with the family. Nevertheless, a DNR is not needed. Patients also think that just because they're going into hospice, that they have to stop all prior medications and only take the palliative medications. Again, this is also a personal choice on how many and which medications a patient wants to keep taking once the focus has been shifted to comfort measures. This also means if the patient wants to continue following up with their cardiologist or ophthalmologist, that they can continue to do so if they wish. Hospice never means giving up. Hospice means having control of the life that is left. It means comfort and support, and it means quality of life. Then there's also that fear that hospice will hasten one's death. Patients seem to think that the comfort medications in place, such as morphine, will only make them pass quicker. However, palliative doctors are very careful with dosages on all medications and will make sure it's only increased in intervals when needed. But again, hospice is about providing comfort at end of life. Some people also think that hospice will be really expensive and that they simply cannot afford it. That's not necessarily the case either. Hospice is covered by Medicare, and nearly anyone going into hospice can be approved by Medicaid. Other private insurances will also cover hospice, whether it be in its entirety or certain portions of it. TRICARE, which is an insurance for military families, is another insurance that covers hospice in its entirety. If patient doesn't have any of these or doesn't qualify for Medicaid, charity care is another option. Hospice won't let someone go without exhausting every avenue first, so very rarely is hospice ever self-pay. So here is a list of the references that I used for this presentation. I also have personal experience with hospice because I have been a hospice nurse for the last 4 years. And I wanted to bring awareness to the community that, it is something that is available. We have so many people that just don't use hospice, and, they're not fully aware of everything that hospice entails. So I did want to bring some education forward and hope that it's not an oversight of any kind. But please take a minute now to complete the post-test and see how much you have improved from the pre-test that you took at the beginning of the presentation. Thank you for your time.